Optimal health for high performers. This is the Health Upgrade Podcast with Dr. Nawaz Habib.
I have a quick favor to ask before we start. It's been shown that if you hit the follow button wherever you're listening to this episode, it will stimulate your vagus nerve, raise your HRV, and eliminate the stress of missing a future episode. That last one is real, actually. The other two came from a study with an N of 1, and the subject was me. Okay, just kidding, but it genuinely helps the show grow. Thank you. Hello, everybody. Welcome back to the Health Upgrade Podcast. This is Dr. Habib. I'm here with my co-host, JP. How are you, sir?
Doing very well today. Thank you.
Amazing. And we are joined by a wonderful guest, Dr. Dana Johnson. How are you, Dana?
I'm doing well. Thank you.
I first learned about you and your work when we were speaking at a similar event. It was an online event called Documenting Hope and had to do with supporting parents whose children were dealing with autism and how to help the parents and the children to progress through their challenges and improve their quality of life. And when I heard you speak, it was an ultimate kind of aha moment. Nice light bulbs were going off in my head, and I said, I need to have you on. And I'm really, really excited to have you here. Your whole focus is on apraxia. And I think this is so powerful for a lot of people once they finally understand what it is and how to address it. And I'd love to just start off understanding your journey. You're a PhD OT. You've got some great work that you've done. I'd love to hear the journey that brought you into discussing apraxia, and then we can get into what apraxia is.
Perfect. Yeah. So I have been in OT for about, when somebody's like 2 decades, I'm like, that sounds really like old, but it's actually accurate. And I met an individual with autism at a sports resort, actually in Muskoka, and did a special needs group over a couple of weeks. And I'll never forget him because he was non-speaking and he wore a tie-dye shirt. And his mom dressed him in a tie-dye shirt for obvious reasons to be able to recognize where he is because he tended to run everywhere. And so it was very helpful to be able to identify him. But I just loved he was 10 and you could just tell that he was totally understanding what we were wanting or asking of him, but it looked like he was misbehaving. And so, or, non-compliant, if you will. And it was that time when I'm like, okay, this is right before I was going to OT school. And so at that point, I was like, I want to learn more about autism. And so I dove into it, and then really any assignment or paper or anything that I did, I somehow was able to weave autism in there so that I could learn more. So I was like literally killing 2 birds with 1 stone. I could learn more about autism, but I could also get this paper done. So learned so much about it, but realized after the fact, you can fast forward about 10 years into my career, I really didn't know about autism because what I was reading was, of course, all the research and the textbooks and the this and that. And it wasn't until I had a client and also read the book Ito in Autism Land that completely changed my view of autism, complex or profound autism to be specific. And in that book, it said OT did nothing for me. And I was like, okay, I need to pay attention to this because I am one and I'm working in this population. And it was where he said, sure, the swinging, the scooter board, the ball pit, all those like sensory things were fun. I mean, who doesn't like to swing for a while? But it really didn't address what the problem was in my body. And that is that I know what you want me to do. I have an idea about what I want you to do or what I want to do, but my body fails me, completely fails. I don't do it when you're asking me to do it, or I want to do it, but my body doesn't do it. And so it's just this, what we call brain-body disconnect. And so I then shifted my whole sensory gym in my center to being more of what it would look like if you walked into a gym, like to work out, where now I have a treadmill, now I have a squat rack, because what that individual and then now my clients tell me is when I can gain intentional movement, I feel better and more in control of my body, and I'm less anxious. I'm less stressed because when I'm walking around unable to figure out where my body is in space, and also the potential of doing something impulsive or something I don't want to do, my anxiety and stress is already elevated. And so that's where everything shifted for me to really then dive into what is called whole body apraxia. And so that's a little bit of my story. And then I can dive into the apraxia piece too.
Yeah, let's definitely get into that, because when people think of apraxia, and a lot of people don't know what we're talking about, we'll pull in some definitions in a moment. But when people talk about apraxia, we tend to talk about apraxia of speech. And you've expanded this out into whole body and body movement and body-brain connectivity between sensory to getting the signals from the body up to the brain and then from the brain down back to the body. And that disconnect is often what's occurring. So let's talk about what apraxia is as a concept, and then let's bring it into this idea of whole body apraxia.
Yeah. So if you were to Google, and this is what is tricky for parents because we all do this, Google put into AI, apraxia, because that's what a lot of my parents do. And what will come out is childhood apraxia of speech, just like what you said, right? So then they're confused because they're like, well, my child's non-speaking, so I guess he doesn't have it. Or they'll go to their speech therapist and the speech therapist says no, that he doesn't qualify for that diagnosis because childhood apraxia of speech is actually an official diagnosis, whereas acquired apraxia, like if you've had a traumatic brain injury or a stroke, that's acquired apraxia, or full body apraxia, that is a symptom. So it's not an official diagnosis in the DSM. It falls under developmental coordination disorder, which is an official diagnosis. So that kind of confuses parents a little bit when I'm talking about all of this and then they're saying, well, can you diagnose my child? And I'll say, no, because it's actually not a diagnosis. It's a symptom for right now. I'd love it to go that direction, but that's why I chose whole body apraxia and talking about this, because it is that. It's based off of that challenge with sensory processing and the differences that the brain has in these individuals with processing that sensory information. And then that's going to directly affect that motor output. And so it's just a simple way of kind of describing that, because we do know that individuals with autism do have difficulties processing incoming sensory information. They seek out certain things, they avoid certain things. And so therefore, their body is going to then be impacted by this, and it's impacted by their difficulty with doing things intentionally. So apraxia is the inability to perform and movement on demand, even when the individual understands what is being asked of them. So that's the technical diagnosis, if you will.
So let me ask you a question. You talk about an inability to process inbound information and a failure to be able to, in an outbound way, affect physical motion or, some verbal cues and responses. And I guess the question I'm going to drive to is there's a phenomenon that occurs in Parkinson's disease, which is eerily similar. And so I'm just first want to just clarify what you're talking about. For example, with the 10-year-old that you were talking about, you could see in his eyes that he understood what was being asked. So there wasn't an inbound processing problem in that the processing was getting done to know what he wanted to do. The problem was, how do I convert that intention into action? And that's the outbound signaling that's messed up. And you see that in the gait disturbance of Parkinson's disease. People typically think of Parkinson's disease as shaking and sort of that wooden appearance. But one of the things that actually leads to injury more than anything else is the gait disturbance, which is they're walking along, shuffling along. And in fact, the reason why they're shuffling is it's a coping mechanism to prevent them from falling. But they're shuffling along and then they want to turn to the right. And the brain, says, yeah, I want to turn to the right. I think I'm about to turn to the right. And some portion of their body turns to the right, but the rest of it doesn't because it just doesn't respond. And so it sounds very similar. And we know that that's an acetylcholine problem. There's a cholinergic deficit that's driving this. So I'm just wondering, putting two and two together, as I like to do, and trying not to get five, is there a cholinergic deficit that you see in these patients?
So interesting you bring that up. And just one point of clarification. When I said processing problem, I was specifically talking about that sensory piece that's on top of it. So the environmental sensory versus me speaking to them, do they process what I'm saying? 100%. I believe that my clients are processing what I'm saying and understanding. It's the filtering of all of that excess sensory, right? So I just want to clarify that. And then secondly, I'm just like, when you were talking, I don't know if you noticed, I'm like, oh, yay, he's going to go into this because there is a hypothesis right now really looking at actually dopamine in the basal ganglia as it relates to the body piece and Parkinson's. But then I just was reading a couple of things the other day about the acetylcholine and the effects there because autism and the motor, what we're seeing right now in the motor planning or lack thereof is very similar to Parkinson's. And the research is starting to become much more, 2017, 2018 were the articles that I was reading the other day. So it's, 10 years almost that we've started to talk about this, but they're becoming more prevalent, which is very exciting. And the reason why I'm very excited about this, also because I nerd out on this kind of stuff too, is because when you're diagnosing autism, there is absolutely no assessment that looks at motor planning. It's all based on observational and not looking at, oh, well, he doesn't have joint attention or she doesn't understand because they're not turning and looking at me on demand, right? Like there's so much misconception about, and goes back to when I was learning about autism. It's like, well, the ADOS, that's it. And it's observational, very subjective, all these things that are like, well, yes, they fit this criteria. And they do. I'm not arguing that they do. They have these behavioral responses, but behavior is actually movement. Like when we break it down, it's actually movement. And so we're observing this behavior, but we're not looking at it like what we would observe in somebody with Parkinson's. We don't look at it like a separate construct. We look at it as part of they're compliant or they're not. They're cognitively there or they're not. We're really missing a huge piece of it. And that's where Dr. Elizabeth Torres really did a lot of research. She started in Parkinson's and then shifted to autism because of the connections that she was seeing. And when she was looking at assessing autism and then therapy for autism, they're just addressing this behavior. Like that's all they're doing is addressing the behavior and not looking at their social communication challenges as a motor based. And if we could look at it from that perspective and then go deeper as to why, like you were saying, dopamine, acetylcholine, the neurotransmitters, we can do a lot of work there as far as supporting these clients with what their real challenge is. And that's, then goes into my work and what I do day to day. But that's I'm very excited that we have these connections and we can talk about this now because that's where I hope the future goes, to helping and supporting and learning more about autism.
Well, I would throw in one other observation that I'm sort of making connections on the fly here, which is the work by Ira Cohen back in the late 1990s, which was pretty phenomenal because I'm pretty sure the AI models that existed in the 1990s are nowhere near what we think of as AI. But what he constructed was a variety of different neural networks to simulate what would happen if you underconnected the neural network. So your neural network has all of these different nodes and they're connected in layers, et cetera. And he underconnected a network and then he overconnected a network. And what he saw was that the neural network that was underconnected had certain failure modes, dysfunctions that were very similar to schizophrenia. And the overconnected network was exhibiting symptoms and behaviors that were similar to what you see in autism. And both of them had the dysfunction of not being able to learn properly and not being able to execute properly, but there were differences in those behaviors. And interestingly, if you go and you look at the brain structures of people who have autism versus schizophrenia, you see exactly the same thing, an underconnection in schizophrenia and overconnection in autism. And we've had, it's been several years now since we had Maria Tremblay on talking about how the immune system in the central in the brain has the task of pruning that network. And so the question is, and we all know, because any listener on this podcast knows that acetylcholine plays a huge role in modulating how those microglial cells are doing that pruning. So I'm just bringing it back again to, hey, what do we know and what can we look at in autism around behavior and you talked about the inability to sort of focus in on one sensory input, all of the sensory inputs coming in, and they can't filter it out because they're overconnected. Their brains are overconnected. There's no pruning away of signals that they should be able to ignore. Not that happens on a second by second basis, but overall, the brain is designed by the immune system to be able to function properly. And if it's overconnected, it won't. And I'm just wondering how that plays into the model in your head of how autism is working at that output level.
Yeah. I mean, this is where I think conversations need to go outside of the typical medical conversation, right? Because what you just hit on is, yes, we're seeing symptoms of a deeper issue. And, we talk about gut issues, we talk about vagal tone, and I know that we can get into all of that, which is really exciting because I've seen my clients who do a number of things. When I say a number of things, it's never just, do this one thing. And because that's not autism, right? You have one person with autism, you've met one person with autism, but it's exciting to see these things. So I think when I have clients come in and I see dysregulation, high impulsivity, really struggling with inhibition, I'm looking at a list of things. It's never just, let's try this. We want to look at, gut issues. We want to look at their ability to regulate what works, what doesn't. I develop like a whole profile because of the individuality of these clients. And then I'll refer out to the experts in those fields because I'm not going to do it all. But I think regulation, and this is where I talk to families about this a lot, because in my PhD work, I don't have an affected child. I don't have a child with autism. So I knew that part of what I was on this earth to do is to support parents to understand their child better. So there was this big gap in my understanding. So I did my dissertation work on the lived experience of a parent of a child with autism. And their stress level is that of combat soldiers. And parents listening probably completely understand that. Well, what does that do to not only them, but their children, right? And the day-to-day. And so I think that addressing that piece of it at the very beginning, because it's a process to help parents to really remember, if you will, what is it like to be regulated? What is it like to feel grounded? Because they're always thinking 6 steps ahead because that's just what they've had to do for the last 25 years, right? And then how does that affect their child and their dysregulation? And so we talk about, that piece of it as part of the overall intervention. Is not just me working with the child or the parent working with the child. It's what is happening within that relationship and that back and forth. And so we do a lot of work on regulation and bringing that piece into it, but then also building intentional movement patterns. And in my early work as an OT and then working in more of a multidisciplinary team, it was very much focused on fine motor skills and gross motor skills. And we'd improve fine motor skills and we'd improve gross motor skills. And I'm like, that's so surface. Like, there's no connection, like the hand over hand. Oh, great. He's writing his name and he's not really engaged in it. You're doing it for him. So there's no, building of pathways. There's no neuroplasticity happening. And that is something that we are very intentional. And so I talk to parents about how regulation's number one, but then intentional work is number two. I don't care if you do 3, movements of whatever we're doing that's very controlled and regulated versus just checking off a list to get through everything. And so really narrowing down, like, what is that intention and why am I doing it? Why am I doing it this way? Because, everybody's busy, everybody's stressed, so the intervention is really focused first and foremost on building regulation within the family dynamic.
I think that's so important to understand is we need to sequence it out, right? And the sequence really does matter. And I'm a huge proponent of this, JP, and I talk about this virtually every week. But the whole idea is that you can't heal when you're stuck in a sympathetic state. And in a situation, in a home situation where there is a child who's suffering and a family who's dealing, regulation is lost, right? We don't have regulation. You can imagine what it's like with kids that have blood sugar dysregulation and challenges when they wake up. Those are at minor levels. We're going to a symptomatic level that's significantly greater. Sequence really does matter. And so it comes down to a beginning in a regulated state, in a state where the nervous system can be regulated, the autonomic nervous system specifically. On this podcast, I do my best to explain the science and make it usable. If you're ready to actually do the work to improve how your vagus nerve functions, then I invite you to join the Health Upgraded community. Inside, you'll find the Vagus Protocol courses and our library of resources. And when you're ready to go deeper with us, we meet live every week with guided sessions, special guests, and a Q&A where the Health Upgraded team, including me, answer your questions personally. It's free to join. Go to healthupgraded.com, and the link is also in the show notes. What are some tools, what are some recommendations that you make to the parents, because obviously they're the ones that are implementing, in those initial stages when they've tried, quote unquote, virtually everything? And regulation is the thing that you're bringing them down to. What are the top kind of 3 or 4 things that you engage them in doing first before they start on that fine motor skills and intentional movement?
Yeah, I think one of the things that is frustrating for me, if you will, is like, there's tons of lists of things that parents can do, right? Like you can go on Instagram and here's the top 10 things that, you could do to help yourself regulate. But it's so different for autism parents because it is a constant stress. And so number one, I want them to feel, what is it like to bring yourself down? Because often they don't know. It's a practice. They have to build that skill. And that's why just even with my clients, it's like, okay, we're going to learn how to take a deep breath because that's an intentional motor skill. And so many of my clients can't do that. It's like blowing their nose, like all of that's intentional. And because they have a motor disability, they can't do it. But you can't also practice taking a deep breath in a stressful situation. You have to build that skill. And so the same thing is with the parents. And I think number one for me is if they're in a session with me and I see all ages. So, sometimes it could be a 28-year-old male who's 6 foot, and very dysregulated and impulsive. And I understand when parents come in, they're up here because they don't know me yet. They don't know the situation. And what they do know is what their child could do. And so it's this what if. And I will say to them, look, I'll ask your help if I need your help, but please just be confident in me being able to work with your child. And in fact, what I want you to do is be very, very intentional with working to ground yourself. Like, don't think about what I'm doing. In fact, close your eyes. And I mean, this is the first time that they're like, right? They don't even know what to do half the time because they don't have that capacity yet. So that is number, literally, I will have parents, I just want you to sit in the car before you go into whatever, close your eyes. And I'll say this and they think I want you to listen to the silence. And they're like, I'm like, really pay attention to the silence, because it's almost like you have to tell them to listen to something, because if you say don't listen to anything, then it's like the brain starts to go. And 100% full disclosure, I had to learn how to do this, right? So I think that it has to start with these baby steps. And that's a poor term. Everybody, I want to presume competence in everyone, but small steps, right? Because I think that everybody has a different capacity. And for me, what I can handle is going to be different than the mom who typically has 2 hours of sleep every night. And so we have to bring it down. So even just sitting, put your reminders on your phone and say, okay, I'm going to have 1 minute of just listening to the silence, closing your eyes, getting everything out. So if we can just do that, number one, that's the step for the next, portion of it. Go ahead.
I'm thinking about it from the standpoint of the individual who has the autism, structural issues in the brain, overconnectedness, has this inability to filter out sensory inputs that are coming in. We talked about that from the very beginning of the conversations because it's such an important piece of the autism puzzle. And the parents, because they are tasked with caring for an individual who has a lot of special needs, a lot of needs, and that's really the definition of special needs is a lot of needs.
A lot.
And you said that they're almost like, a combat veteran, who's been in battle pretty much continuously for some decades. That person who doesn't have autism, who's responsible for that, the person who does, is going to have a heightened level of sympathetic activation. And we as non-autistic individuals have what we'll term, it's not fair, but we'll call it normal sensory inputs, conscious understanding. Nothing that your body language or Navaz's body language right now is startling to me. But for a person who has this hypersensitivity as a function of the structure of their brain, it's really important for them to be surrounded by people who have the ability to regulate themselves, because they're going to be almost like the ultimate empathizers. They are going to just absorb any stress and any level of heightened anxiety, and it's going to go into them. And they are desperately seeking themselves to quiet their own internal, noise, which is why they exhibit, OCD-like behavior. It's not because they're gaining the benefit. Like a person who has true OCD is actually, I won't say enjoying, but is gaining relief from that movement. It is a desperate attempt on the part of the autistic individual to just silence the noise.
Yeah.
So just wondering how, when is that really the purpose and the reason why you're asking the caregiver to regulate, is because you see that has an effect on your patient?
100%. I will say to families all the time, because especially as an OT, and we're always in the sensory processing, sensory integration field. It's like, well, do this, get on a swing, squeeze them, do this to your child, which, yes, that's going to help ground them or give them the input that their brain is seeking to help organize their body. Those things can be effective. But I'll say to parents, the number one co-regulator and the most powerful co-regulator is you. And I don't say it to put pressure on, because it can sound like that. But the reality is, just like you were saying, when we surround ourselves with regulated people, or if that parent surrounded themselves with regulated people, they're going to find their nervous system does start to regulate. So it does start with the parent. And part of it is like practical things. But the other piece of what I do is that huge educational component, because up until most of the time when they've seen me, they believe like, my child doesn't understand. He's functioning at a 3-year-old level, because that's what, I was told. And then number two is that he has all these behaviors and he's non-compliant. Like, it's all negative stuff, right? So they've been living in this negativity, which also is not supportive of them. And, not hearing or understanding, why is my child doing this behavior and what is causing that behavior? Because they hear it's, well, this is just autism. This is it. Like, they're going to have GI, they're going to be in pain, they're going to have these behaviors. They're like, that's all they hear. And so it could be years of this, it could be a year of it, but it's still, I still work with families from the get-go of working on their regulation for the parent. And then when they can see, because they implement or they work on their own system, even if it's just a little bit, the observations and what they see and the reaction of their child to when they're working on these things, it's like, it's the best thing ever. I don't really have to do it because they feel it, they sense it, and that then drives them to continue to do that. So yes, I mean, that is key. It's key for all. I mean, if we're not regulated, we're not going to be at our best either. So
yeah, the whole idea behind co-regulation actually starts with regulating one of the two people or one person in the group initially. And it has to be the person who can take in that input and create that space or create that regulatory environment in the first place. Because what we're trying to do is create a feeling of safety, right? Safety is that driving force that turns on the vagus nerve. It's that driving feeling that is required. And when there's so many sensory inputs, even just as non-sufferers ourselves, when there's 1,000 noises going around because the kids are doing this and the dishwasher's doing that and this issue's going on here, and that overwhelm becomes in itself a challenge with regulation. And so what we need to do is learn to regulate ourselves. And you can imagine what those who are suffering are constantly getting all of the input super loud all the time. We can't put the onus on them to learn to regulate. So it's got to be on us to create that sense of safety, that safe space, and regulation will ideally be passed over because when we feel safe, they feel safe. And I think that's so important to point to. But I want to lead into something because when we talk about regulation, we tend to talk a lot about emotional and psychological regulation or behavioral regulation. We tend to miss out on biochemical regulation.
Mhm.
And I think that is an important factor here. And you've mentioned gut health a couple of times. I want to lead into gut health, the idea behind blood sugar.
Mhm.
Do me a favor, connect the dots here. How does biochemistry being dysregulated lead to or add to the symptomatic nature that a lot of these people are suffering from?
Yeah, I mean, it's part of my discussion with families because the majority of the clients that I see are very complex with complex, not only bodies, but just when I dig deeper into, okay, so tell me about the diet, tell me about sleep, tell me about, those foundational pieces. They eat three things and they're all carbs. And, like it starts to really reveal, a lot of those challenges that I'm seeing in front of me and why that might be the case. And so, over the last number of years, I've really been diving deeper into all of this because I couldn't see a client come in and then go, oh, well, we'll just work on regulation. Because to your point, I can co-regulate like it's, my job. Well, it is my job, but, like really well, but it's not going to last if they're dumping sugar and And so I learned and have learned a ton and will continue to learn more about that. And I just know, just living in our toxic soup for all of us right now, we're dealing with it. But certainly for them being exposed to various toxins, whether it's what they're putting in their body and lack of sleep and biochemically, metabolically, like that has a massive impact on their ability to regulate. And so, again, I wish that I could just, have 5 families that I just work with for a year and just help them through all of it. It's not feasible. And there are a lot more people who are a lot smarter than me in certain fields that I can go, hey, this is, I think, where you need to land on that. So I can help, guide parents with it, but at least get the conversation going. And that 100% has been something that I have seen with respect to gut issue. I mean, I have to tell you, it's probably like 95% of my clients come in, and on their intakes, it's like we're, either drinking Miralax every day, or we just talk about doing, various methods to help with constipation. And again, they're like, well, I go to the doctor and that's just what they tell me is what we're going to have to deal with. So it's a big issue. And so when I talk to them, and I'm talking to them as simple and not overwhelming as I can, because again, going back to what they're dealing with on a daily basis, I really try and to explain that like what's coming into the body is going to affect the brain. And we talk about neuroinflammation, and we talk about what I'm seeing your son or daughter doing right now could very well be due to that neuroinflammation. It's tricky because if I say, what is their diet like? And it's three things. It's chicken nuggets and donuts and Coke or whatever, right? Like that's all they eat. And so if I said, oh, wow, now you need to go on a Whole Foods unprocessed, like peace out, not, can't, nope, shut down, right? So it's definitely a step-by-step conversation. And I have, various strategies depending on where they're at to kind of help support them with that. But hands down, that's not even, a question about whether or not that's connected. Even just in the population that I see with the motor challenges, they're not getting out. And I mean, nobody's getting out and doing exercise anymore, but certainly these guys and girls with motor planning challenges, it looks like they don't want to do something. They're stuck on the couch. They're on their iPads. They're not getting that input that they need to support their body and movement. So that's a whole other thing talking about, the type 2 diabetes in autism is massive.
Yeah, and there's a lot of work that's been done over the last couple of decades looking at the ketogenic diet as a potential, way to help people with autism function better, and trying to understand why that is. And clearly, the metabolic effects are what's at play, but it's also the reduction in inflammation. I'm wondering whether or not I'm just putting two and two together here. And the way that metabolic dysregulation affects the immune system is at least in part due to reactive oxygen species being released because of mitochondrial dysfunction. There are compounds like urolithin A and methylene blue, which can either help to regenerate and create more healthy mitochondria or help reduce the electron leakage. Do you know of, or have you seen any work showing that, if you can't get your child to go on a ketogenic diet because they're eating three things,
right,
at least if you help them supplement with these relatively simple things to include, they will gain better regulation?
Mm-hmm. I have not seen specific research on that. I do know, the research in mitochondrial dysfunction and autism is obviously strong and is out there. I talk about exercise and specifically, resistance training and aerobic trainings, with my clients and their families, because talking about mitochondrial health, talking about, exactly what you were saying in terms of regeneration, that also is a great way to do that. However, it's hard.
Well, that's why I'm thinking a supplement that sort of is exercise in a bottle, or something like urolithin A or methylene blue or some of the other things that are available might be possible treatments that would enable them to gain some control, and then maybe you can make the lifestyle changes after that.
Exactly. And a lot of times it's in small steps, right? Like it's in, okay, and it's small steps, but it's very determined on where's the parent in what can they feel successful with? Because I'm also working on that angle too, right? Like if it's not like the client, I can have them do it. It's really I'm balancing that piece of it, and I really have to pay attention to what are they open to doing. And to your point, most families are going to say, if I can put this in their food and that's going to help with this, I'm going to do that because movement is too hard. So yes, yes. And I believe that I'm noticed Urolith NA, I think that Dr. Fry and Rosignol have looked at that. I'll have to dig deeper into those papers, but Dr. Fry has done a lot of research on mitochondrial dysfunction. And I know that many of my clients have seen them because of mitochondrial dysfunction. Like that's also something that is significantly impacting their ability for regulation, and just overall health and function. But yeah, that would be a great study.
Yeah, there's some peptides out there, MOTS-c and humanin, which may also be beneficial. If we're going to target the mitochondria, you might as well go right at it.
Yeah, it's funny you bring that up because there's a couple things. The other thing is BPC 157, right? With the gut stuff. And I actually had at least the first client that has documented to me that they're using BPC, but that I'm very curious about. And I've connected with a couple of other doctors who that is what they, gut health. And I'm like, so what are your thoughts on this? Because they have a whole, protocol. And I'm like, what do you think about peptides and supporting gut? Because that is a massive issue with it. But yeah, MOTS-c too. I'd be very curious to look at that and to see what outcomes happen.
Yeah, I could be interesting.
Yeah, for sure. For sure. And with the respect to the keto diet, that is something I've spoken to Dr. John Gatanis has done work in that he's a neurologist, so seizures is his. And so he and I spoke at length a number of years ago because just even for me personally, shifting to that diet has helped me immensely with my health. And as I'm dealing with some of these things and looking into it, I'm like, well, I know for seizures, that's, a common protocol, but what about with neuroinflammation with autism? And it always goes back to, well, how do you get the food thing, the texture thing, I only have 3 things that I'm going to eat, and parents who are like, at least I can get them to eat something, so that also is very interesting to me. And I would hypothesize that would be very beneficial.
I would love for you to walk us through a case where it's kind of successful in terms of what the goals are and what the patient is ultimately and the family is ultimately able to accomplish. I would love to kind of understand what that journey looks like for a family who's been suffering for some time and what working with you looks like and some of the implementations when you begin with the sequencing of regulation and working through the motor patterning and some of the recommendations that you might provide on the gut health and the blood sugar regulation. What does a general or good case kind of look like in that journey?
Yeah. And, I'm trying to think, okay, autism, very different, every single one. But no, I think that for me, so I obviously work on the whole body apraxia piece. The other piece of it is working on supporting communication because the majority of my clients that I see do not have a reliable way to communicate. And so communication is motor skills. And that's, part of what I do as well is build on the capacity for the individual to use motor skills to be able to spell or type to communicate. And so it goes hand in hand because we look at the most fine motor movements of our body, being the eyes and the articulators. And, the majority of my clients don't even have control over their entire body, gross motor movements. And so we have to start by working on some of those gross motor patterns. And that can still be supporting communication. But I'm also looking at internally, health-wise, I'm looking at vision. So when I work with a family, I have a whole intake that they are so grateful. I thank parents every single time because depending on the age, it might be like the 600 intake that they've had to do. So I'm grateful for their time because it's detailed, but it gives me this picture of where are they? They can tell me about diet if they do. And then they're doing great with that. Well, then, I'm going to go to the next thing and then the next thing. So I think a specific case, really was where I had this family come in and, the older families that come to see me, it's so great to see them because they're typically, I've done everything, I've given up, not given up, I've just accepted that this is where my son or daughter is going to be. And I heard about you on a podcast or whatever. And so I just thought, why not? Right. So they come in and I'm just applauding them because that's a big jump to do that and to like open Pandora's box again. If that happens, like what if it doesn't? Then it's a big crash. And so we do talk about the communication aspect of it and building those motor skills so they have reliable communication. And we also talk about the intentional movement. And so this particular client I think he was 25 and by the way, the oldest client that I've ever seen was 58 coming in. And it was this woman, she came in with her 70-some-year-old parents, and it was amazing. But great story. But this one specific was, typical, only ate a couple things, had no reliable communication, very dysregulated, was on antipsychotics, SSR, you give the list of, he had seizures, so he was, on seizure meds, that is really intense as well. We haven't really talked about that, but that's all, really common. And obviously you can't just stop those. It's got to be planned, programmed. So Mom and Dad were both very overwhelmed, as you can imagine. And, at one point in time, they were literally hostages in their house because when they would go out, it would become something that could get dangerous for not only their son, but them. And so I, took the history in and we started talking about diet and getting that going. And the number one thing that I'll say to families right from the start is I don't want you to take anything away at first, because so often that's what it is taking things out of their diet. And so I'll say, I want you to introduce certain things, and we'll talk about those things. And introducing something isn't twice. We're going to commit, and we're going to commit for weeks at a time. So that slowly started that was the first thing. We talked about regulation, obviously, and what that meant. Mom and Dad, I highly recommended that they found a therapist because they had their own trauma as well that they needed to deal with and to work through, some of which was, the injurious behavior of their son towards them. So they needed to work on that because that was really creating heightened cortisol with everybody. And long story short, really with it is that this was probably over a period of 8 to 10 months where we addressed the diet piece. We had parents working on their own regulation and working through some trauma. The client was working on building that communication so that he would be able to then say what hurts, say, all these different things. So we did that. And then I also put together an intentional movement program. And that is in and of itself building the purposeful movement, but also it's exercise, really, is what it is going through functional movement patterns, but the resistance of the weights is giving the input sensory-wise where they can feel their body and therefore build the more intentional movement pathways. And yes, so this went on for about 8 months. They came to see me for an intensive. They went back home, worked on things, came back. We did Zoom. And yeah, after about 10 months, they're still working on really, ramping up the diet. But even these little things, and this is what I say, these little things mean so much. He stopped drinking soda all the time. And Mom was just like, even that? And I'm like, I know. And so it was just these, again, these little tiny steps towards. And the biggest thing, is he openly communicating and reliably communicating yet? Not quite, but he's getting really close to that. Does he exercise every day? Is his, diet perfect? No. But the biggest thing for me is that the parents see him completely differently. They presume competence. They know that he understands and that he can learn. That totally shifts their mindset. They have worked internally on themselves, so they feel more empowered. They feel more confident to help regulate him. They understand their co-regulation for him. So it's completely transformed their household. Is it perfect? No. Does he still have impulsivity and some injurious happening? Yes, but it is typically due to either a seizure coming on or, gut pain or something he ate and so they're learning and they're taking data, which is also very empowering. So that I would say would probably be the case where, I started them off and it's just really simple steps, but we're seeing these gains and these wins, which is then perpetuating the consistency.
Sounds like they went from very reactionary to very hopeful and guided with the plan, and having that guided plan and having worked through a lot of their own preconceptions or misconceptions and their perception changing then alters the landscape of the home. And what that does is it creates a space that feels more regulated. Maybe not all the time, but my house isn't perfect.
Right.
Everybody has
Yeah.
chaos a little bit in their house. So the idea is progress over perfection here, right? That we work for progression, especially in a situation that something like autism tends to crystallize, right? Patterns become very, very habitual. And any deviation from that habit or that pattern is very challenging for these families to undertake. And so we figure out what they're willing to do and we go with it. And it's very challenging to make changes there. So I love what you said there about don't take away first, introduce and commit to it for a long term, because what you're doing is you're taking, it takes longer to build familiarity in these situations because something is already crystallized. Introducing something new is beneficial, and then you can slowly move to eliminate something else over that same stretch, I think is probably the move that you're trying to make. And that whole shift to a whole family improving their metabolic function, improving their physical environment, improving how they're showing up and regulating themselves, even progressively, is so powerful in that healing journey.
And I think, one of the biggest things that I talk to families about, and this is a mindset shift, right? Where it's the easiest thing because it's just a mindset, but it's the hardest thing because it's a mindset. And so, like you had said, we have these things that have crystallized because they are functioning. We're functioning, so we're going to keep doing it. But we also have these beliefs that come with that we've told ourselves are facts. And so to get that mindset shift, we have to start questioning these beliefs, which isn't easy for any of us to question our beliefs. But when we can start to do that and we practice doing that, that's when this mindset shift really starts to take root. And parents see, like you said, hope, right? Because that's not their automatic. It's not hope anymore. It might have been, 20 years ago, but it's not that. And so if I can help them on that journey to start to see more hope every day, that's when we are like, okay, I can identify that now as a belief. He's not doing that on purpose, or he's doing this. And so that's a belief that I had that somebody told me. And now I know that's not a fact. And here's why. So that's where that process starts to shift that mindset.
Yeah, I love that. JP, any thoughts? Any final questions?
My brain has, so many different questions, and I'm really fascinated by the opportunity to delve into some of these interventions that may be beneficial. Things like vagus nerve stimulation, things like ketogenic diet, things like methylene blue, and other mitochondrial supports. I think it's just fascinating to me how the field is recognizing mitochondrial dysfunction as potentially a core piece of the pathology. And the question is, can you do things to reverse the damage that's been done or to alter the architecture in a way that's beneficial? I realize that that's probably too much to hope for, but I'm prone to hoping for things that are beyond possible, because what's impossible today is possible tomorrow.
Exactly. Yeah. Yeah. No, I am excited too. And as you were talking, JP, about, what about this and what about that? Then my mind starts to go this way, because it is. I mean, even now, peptides are starting to become so much more, talked about. And, I know that I think it's the 23rd of July, the FDA is going back to talk about these, to hopefully, fingers crossed, make it more available to people. And I think when that happens, that is, I think, opening so many opportunities for many people, but certainly with what we're seeing in autism, the possibility of, reverse, who knows, right? I just think It's endless. It's endless to think about. Exciting.
It's
I think
exciting.
it's also really important to look at exercise as being mitochondrial medicine and movement being
Absolutely.
mitochondrial medicine, right? And yes, it may not be easy to plug into every single situation, but that's essentially what you're trying to implement in some capacity. That if we can or intervene with some movement patterning, movement control, motor capacity, you're actually building muscle, and muscle is so dense in mitochondria, and that's regulating the mitochondria, that you're eventually going to have a beneficial effect of longevity, of symptomatic relief in some capacity. And we've seen kids and adults progress. There have been many cases of real progress that include a lot of movement patterning, that include the addressing of this whole body apraxia focus.
You see it. You see it with both Parkinson's patients and with Tourette's patients, where they don't have control over their bodies until you put them into a setting where they're doing something physically that's sort of natural for them, that they've trained on. I have a good friend of mine who has Parkinson's disease, and when he's moving around, he's shuffling, he's not really walking, he's got that stiff gait. But the moment he gets out on a pickleball court, he can play pickleball as if he didn't have any problems at all. I mean, he's 75 years old, so he's not playing like he's 25, but he's not playing like he's got Parkinson's disease. And then he comes off the court, and it's literally like he transforms back into something else. But for that hour, he's free. Same thing with there was a basketball player who had pretty severe Tourette syndrome. I think his name was Mahmoud Abdul Rauf, and he was able to play basketball, even though when he was dribbling up the court slowly, you could see his body contorting. He had dyskinesia, and yet he has the record for the greatest number of free throws, highest free throw percentage. He was like 99.7% from free throw. I think he hit like 997 out of 1,000 in a row once.
Wow.
It's that ability that comes from that getting control, because he needed to get that in order to be able to function.
Yeah.
So
it sounds like intentionality and intent
Yeah.
are the driving factor there.
For sure. And that's, when I talk to my clients who obviously give me feedback and they're the ones that want to engage in intense exercise because of what you just said, JP, because for a time they feel like they have control of their body. And the challenging part is the initiation piece, because part of whole body apraxia is initiating the body to do something. And so as a parent looking at your child going, well, they're not getting off the couch. They don't want to, right? Like it's either they don't want to, they didn't hear me, or they don't understand what I'm asking them to do, because we read what the body is doing and gives us feedback. But when you have whole body apraxia, what your body's doing isn't always what you want it to do. And so most of the time, parents don't really know if it's like they don't want to get off the couch, or they do, but they just can't initiate to get going. And so that's where part of the parent education and parent coaching is, okay, this is how you're going to coach your child to be able to get into this movement. And just like all of us with motor planning, once you start practicing this movement, it becomes automatic. And then it extends even further from giving the body awareness and feeling in control of their body. It extends into day-to-day life of being able to do things and picking up motor plans quicker. Obviously, regulation, it's helping with that because you feel more grounded. Like exercise is really, and like the priority in my, again, list of things to do, but it can't always happen right away for many of my clients and families for a variety of reasons. But I'm glad you brought it up, because I think, yes, we want to sometimes go quick to the fast and let's pop a pill, but exercise goes beyond building mitochondria and for longevity and all of that, especially for my clients with whole body apraxia.
So let me ask you a question, because we've talked about the regulation of the parents as sort of co-regulating factors for the person that's your client. And we've talked about diet, we've talked about exercise. I'm seeing those as sort of three legs of the stool. But for all of those people out there who are dealing with either as an individual who has autism or as a caregiver, they can't all come to you, and they're out there. And with any luck, we have people who are listening who are seeking this information. And if you know somebody who has this, by all means, get this podcast to that person and have them listen to it. But if you could summarize sort of the top 3 or 5 things, and maybe we just did to a certain extent, what are the most potent and powerful tools in your armamentarium to help people begin to get that ability to regulate, ability to communicate better, to feel better? What are the most effective tools in general?
I think the first thing, which is, my mission in all of this, is to understand what whole body apraxia is. Because if we've never heard of it or understand it, and it's not, a specific thing like exercise or food and all of that, but that's really where I was seeing a disconnect between my clients coming in and going, okay, well, I've been told this, and somebody told me that I'm supposed to presume that my kid can understand. Like, how is this? And then when I explain, okay, well, this is why their body is doing this, and it looks like this, but why I'm saying to you that they can understand, and that missing piece is understanding that they have a motor disability where there's lack of connection. Now I can go, okay, so now I can understand and presume that they're understanding that they know me, who I am, what I'm asking them to do, but they have a motor disability. That in and of itself, I can't tell you how many parents come to see me. And then like that night, they're going, I'm talking to him now like he's 25 instead of 5. And he just totally turned and looked at me and like was engaging. Like I could tell he was engaging. So that in and of itself is like pretty much that first thing, because then you can go, okay, so here's an example with the food. So with the food, he only eats 3 things. Well, that could be true. He only likes 3 things. Or because of his whole body apraxia, he isn't going to eat anything else, but he inside is dying for a burger, right? Like, but the automatic of just grabbing the chicken fingers and fries is just what he's always done. But we wouldn't know that, so things start to trickle down. So number 1 is really understanding that, because that opens up a whole different realm of understanding with your child. And then, diet and sleep, like all of that is foundational, and diet really with gut health and working on that piece of it. And then like understanding that you can coach your son or daughter, breaking down the steps of a movement, working on your regulation while you're doing it. I'm just saying all these things just as I'm thinking about them. There's a process for every family. But yes, diet, regulation, co-regulation, understanding the movement. How long of a list do you want, JP?
Oh, that's good. That's good. The average listener out there who's dealing with this none of them are average people, because they're phenomenal people.
Right. Yes.
They're gonna take a few of these things and hopefully bring them into their own homes and be able to do something to help themselves and to help the person that they're caring for. So we appreciate that.
Yeah, you're welcome.
Yeah.
Of course.
We are honored to have had you here. I really just want to bring up this idea that even like for us, when we exercise, right? JP runs, 22,000 miles a day, something like that.
Around the world once a day.
Wow, that's impressive.
And I love getting on my bike and going for a ride. And when you come back, or when you finish that exercise, that movement, there's almost a meditative experience when you're in there. And exercise in itself is very regulating. And so for me, I think that's what you're trying to bring into a world that has overlooked this piece, unfortunately, for a very long time. And the idea of we can, through exercise, not just build muscle, not just support mitochondria, but help build regulation in the body. And that it begins with body movements with intent that can help to create these opportunities for healing to occur. Because again, we cannot heal when we're dysregulated. We cannot heal when we're stuck in a sympathetic state. So This has been awesome. I've loved this conversation. We haven't had enough conversations on the autism side of things, so I think this is a really great one for us to share. And I think for anybody who got to this point in the podcast, you definitely need to share this with somebody who is suffering or a family that could use this information to improve how things are going overall. Dr. Johnson, thank you so much for joining us today, for sharing your expertise, your brilliance with us. This has been awesome. I've really appreciated every minute of it. Any final thoughts? Where can people find you? Where can anybody who's looking, where can they reach out to you?
Yeah, well, first of all, thank you both so much. I love just sitting, having conversations, because I learn, I think, just as much from the podcast that I'm on as I hope that I'm able to deliver in terms of information. So I am on YouTube. So part of that YouTube channel is really to educate about whole body apraxia. So YouTube at Dr. Dana Johnson. My socials, Instagram, Facebook, X, all the same, Dr. Dana Johnson. And website is Dr. Dana Johnson. So super easy to kind of find everything there, and people can see videos, reach out. Hopefully there's a lot of resources. I'm constantly adding different things just because I'm finding, more information, and I want to get that info out there. So thank you.
I love it. Thank you so much again. Like I said, share this with somebody who could use this information to improve the quality of their family's lives. And I think there's a lot that can be had for practitioners as well. A lot of practitioners are listening. Use this information in your practice, implement, reach out to Dr. Johnson and learn how exercise, movement, and addressing whole body apraxia can be so beneficial for your patients. Thank you again, and we'll catch you all on the next one.
The Health Upgrade podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions. Our content may include sponsorship and affiliate links, through which we earn a small commission on sales made through those links.